This episode is proudly brought to you by the Afrocentric Group, Southern Africa's most diversified healthcare group, building a winning health offering. Hello and welcome to another edition of AI Impact Talk with me, Tembekile Mkhototo. And today we've got another guest who's going to show us, or tell us in fact, more about how artificial intelligence is basically being incorporated into how businesses in South Africa do their daily work for the benefit not just of themselves, but for you, the end user as well. We're joined by Singh, who is the Chief Information Officer for Sanlam Corporate and Health. They're a key brand, a friend, in fact, to AI Impact Talk because Afrocentric is, in fact, the sponsor of this season of our podcast. Ashley, welcome to AI Impact Talk. Good to have you with us. Sanlam Corporate and Health. Quite a bit to take in. Explain how those two worlds collide, basically.
Sure. Now, afternoon, and thanks for having me. I'm really excited about this topic and to engage you on what we've been working on in the last few months and years. So Sanlam is the largest non-banking institution on our continent. It's a real muscle between all the retirement, group risk, and investment products that we can allow our members to live with confidence on. We've been, from a strategic perspective, looking at how do we complete that suite of products. And one of the key missing gaps in that is a medical capability. Enter Afrocentric. And that's when Sanlam invested heavily in Afrocentric to partner with Afrocentric to enable a complete value proposition to our members. One that covers health, retirement, risk, and investment. Your one-stop shop for all your needs.
And then where AI is concerned then, how does that fit into the picture when you look at the big conversations around creating sort of digital transformation and the synergy when you're combining different aspects?
So as tech professionals, I always say that we get paid to play. We love technology. We love experimenting in new technology. But as you're aware, it's an extremely costly path to walk, and one that you need space, you need investment, and you need the skills. So Sanlam, having the might that it does have, being, as I said, the largest non-banking institution, it's able to invest heavily, and Afrocentric can get the partnership or the benefit of that investment. So when we play with AI use cases at a Sanlam level, we incorporate the health components to it, and we're able then to have a varied playpen to take AI forward.
And for Afrocentric, value-based care is what then becomes important, right?
Yes, 100%. So the key message in value-based care is not to engage a patient with, what's the matter with you? Is it diabetes? Is it a condition you have? But what matters to you? And Richard from Netcare actually coined that particular phrase, and that's how we're moving from an AI perspective into the managed care space. So it's all about, we see you as an individual, we analyze you in terms of any conditions that haven't seeped up yet, and we put preventative measures to make you enjoy your lifestyle better. Or it could be that you need a more personal medical route to help you on your managed care environment, on your dreaded disease, be it diabetes or any other chronic condition you may have. Give AI into the ability to actually live with a better sounding.
It's interesting that, yes, you're bringing in a system that's not necessarily human, but you are still human-centered in the sense that
100%.
It has to ultimately, at the end, provide the patient or the person with an answer that speaks to them individually. Am I right?
Spot on. And it's an application as old as time itself. AI is not something that should be seen as separate to you, but it's an augmentation of you.
We're scared, Ashley.
You'd use prosthetic limbs in the past. You wear glasses at this point in time. AI is nothing more than an extension or enhancement of you.
And for Sanlam then, away from Afrocentric, but Sanlam as a different aspect of your roles.
Yes.
Where then does AI improve your ability to deliver?
In every aspect. So firstly, in the operational journey, we have multiple processes in our environment. AI makes us do those processes quicker, faster, and better. End result is you are serviced quicker. In the other aspect is we are able to identify needs that you haven't yet hit that milestone that you realize you need or will need. Remember, insurance is obviously seen as a grudge purchase, whereas now this gives you the ability to not see it in that vein, to see it as, I'm in need now, and AI has helped me to get to this point.
And a lot of people are trying, especially businesses, to be able to get a clear sort of risk assessment when you talk about financial services. But also they want it to be a fair process towards them as well. How sensitive does the system allow you to be to that?
It's all in the application. And one of the reasons why I think Sanlam's definitely embarking on this process well is that it's a transparent manner. It's on education. What are we using AI for? You can have a warm touch if you want, or you can have the AI touch if you want. There's complete transparency, and it's completely human-centered and human first.
And for those of us who are almost at the end of our, so we say, employment workspan,
Yes.
retirement
Yes.
is key. It's a constant fear. What about them?
So this helps you educate you. This shows you scenario planning that is unique to you. At 50, this is how your life's going to trend, and these are your financial needs in a much more scientific manner than we could have ever done before.
So you're basically able to map out
Yes.
in a way that we've not been able to do the needs of a person almost by the decade.
Spot on. And if you marry that with health, we can then predict conditions that you may have as you approach that particular age as well, and then enhance your financial upkeep at that point in time.
When you talk money, you think about fraud, right? The scammers are no longer on the side of the road. You no longer have to go to a website. They are on your apps. They're on your social media.
Correct.
Are you able then to respond to that?
So they evolve extremely quickly. Yes, so we have that's another benefit of the partnership. Sanlam invests as much as they do in AI into cybersecurity to create that protection, and Afrocentric benefits from that. So we continuously evolve. We have a major arm and continuous learning to actually keep up that gate or the protection.
And how do you, as an organization, respond to the fear or sort of, there's an apprehension sometimes from people, even the workforce itself fears still conversations around introduction of AI. Will it replace the workers? But if I'm a customer dealing with a quote-unquote machine, will it be the same?
Yes, no, spot on. And that's the biggest issue we're grappling with as an industry globally. And the approach we've taken is to make it human-centered. So we start with training. Before we drop AI into any environment, all employees are trained into what is AI, how can it be used, and demystify it. And then with the engagement with our member, we want that experience to be as seamless as possible. The member is interested in the product that they get or the output that they get. So if we can make that as seamless as possible, the experience is, whether it's human or AI, is immaterial.
There's also an incredible burden, just to your previous response, around protecting then the data, because you're dealing with a lot of information.
Yes.
So what is that sort of required of you in terms of a change to make sure that you're able to guarantee the safety of the information at your disposal?
So it's twofold. One is the technical protection of the data behind firewalls and the cybersecurity components. And two, it is what do we do with the data and who has access to that data. So we make sure that because this is sensitive member data or patient data, that it's encrypted for the general backend use, and only those that have a specific need have access to the data. So it's very much a control perspective.
And how helpful has AI itself been in sort of getting that level of governance, if I can phrase it in that way, correct?
Spot on. It actually builds in governance without you knowing there's governance. It'll flag abnormal uses of the data. It'll flag that this particular person is using the data in a certain way, or a breach in governance. So it actually enhances governance.
And again, to what we were talking about right at the beginning, that because you have so much in your basket, there has to be a link, right? Gone are the days where I would walk from my department 3 floors up to fetch a file, come back downstairs, go through that information, and the other person would do the same. You then have to have a system that is linked, in a sense, for you internally and again for the end user. Have you been able to get that right? Are you happy with who you are?
So we struggle with it. Most organizations struggle if you've got an old organization that has legacy systems and technology, as you mentioned, and knitting that together with the latest. We have embarked on a very strong modernization journey, and that helps us bridge that exact gap that you've said. We've empowered that modernization journey in the sound principles of cloud, and we're very comfortable right now that this is the base we need to move forward.
And what does the future of AI look like in your dual industries, if I can phrase it that way?
So it's seamless. It's one that works completely agnostic. It's one that works between human, AI agent, as it's now called, and moves seamlessly between the two organizations, putting the member first, servicing the member first.
And in terms of potential, what excites you? When I speak to tech people weekly, everyone is buzzing with just the level of opportunity and where things could go, not even in a year, sometimes within months of where we are.
How much time do we have?
I mean, we've only got all day.
I believe this is going to be as disruptive as moving from a horse cart to a car. It's going to be that transformative and that disruptive. It's going to change everything in terms of the way we administer products, the way we receive healthcare, the way we work with the patient. It's going to change that fundamentally. But the power in all of that relies in how to use that in an ethical manner and how to use that in a secure manner.
And shared value, how do you get shared value right in South Africa's context? Because our country is different in many ways to the rest of the world, even though we're a globalized world, essentially.
Yes. So shared value definitely starts with looking at the local context that we have. And we have large populations in South Africa that are unbankable. And then if you lay that on around the medical care, it's even worse. Access to medical care in this country is completely fragmented. I believe AI is going to start moving the dial between the two. It'll make much more affordable healthcare, it'll make much more personalized healthcare, and make it accessible to everyone.
So doing away with the idea basically that this is niche. It's for upper to middle class, middle to upper class.
Correct. And it actually breaks down the barriers. If a large organization like Afrocentric gets AI right, which they will do, it will then make the gap between the extremely rich and the extremely poor narrower, and access to healthcare.
What kind of leadership then do we need to get that right? Because those are the people who call the shots and make the decisions, right?
Spot on. You need the complete opposite of what you would think. You don't need a tech leader. You need a person-centric leader.
So even I can do it.
You can. CIO Tembekile.
So what do we need? You said we don't necessarily need CEOs who are geeks.
Yes.
Are we still allowed to use that word, by the
100%.
way?
I get called that all the time.
So we don't necessarily need the geeks in charge, but what do we need?
We need people that can look at tech and look at the person and bring that together harmoniously. Not just be caught up with the profits of a company, not just be caught up with the tech for the tech's sake, but what really matters to the individual. What is really the problem you want to solve, and bring that together. Because if you want to now spin up a tech component, AI does that for us easily now. But it's the application and the human intervention of that that's needed.
And we've been asking people all season one question: what does AI mean to you? If you take off your professional cap as someone with a genuine interest in AI, what does it mean to you?
I mean, it's such a good question, and I could say so many components here. But to me, fundamentally, it means making life easier, and making life better.
And can we do that cheaply?
We can, once we get the base in place. Once the base, and remember, no one has really cracked what AI can be practically on the ground. It's still something that we are grappling with how and why, right? Once we crack that base, it'll definitely become more affordable.
Why do you think there's been such a, I don't want to say slow, but perhaps delayed uptake in terms of what is available, especially when you look at the need for financial services? Healthcare in this country is a big issue. We're trying to get it right for everyone across income brackets, etc.
So the biggest stumbling block is firstly the models that run AI. I mean, those models are still being changed, and the new models coming up all the time as we speak, right? And they need large processing power. So access to those models and customizing that is a challenge. And the second one is the data. Where is the data stored? And data sovereignty and residency is extremely important. And in our country, in South Africa, member data, our schemes and our policies don't easily allow it for it to be residing in UK, as an example, where some of these fancy systems reside. So managing those two carefully, it has been a stumbling block, but we're getting better. We're changing policy, and we're making massive strides in the cost of the tech.
Well, hopefully when I speak to you in the next year, we would have advanced much further. Ashley Singh, good to talk to you. Ashley is Sanlam's, Sanlam Corporate and Health. Let me get that right. Ashley Singh, Sanlam Chief Information Officer, Sanlam Health, Sanlam Corporate and Health. I finally managed to get that out. But thank you so much for joining us on this edition of AI Impact Talk with me, Tembekile Mkhototo. See you soon. This episode is proudly brought to you by the Afrocentric Group, Southern Africa's most diversified healthcare group, building a winning health offering.